Welcome back, my people. We are still looking at the steps you can initiate, or the first aid you can give, or the first action you can take after injuring your muscle. And before we continue, let me start by appreciating you people for the far you have taken me. Thank you for the subscription, thank you for the likes, thank you for the comments. Thank you for those who are bringing out their topics for discussion, because it's keeping this channel going and people are learning more. Most of the people are appreciating our content, and for those who have not subscribed, the bigger number has not subscribed. Let's continue subscribing, liking and sharing. Make sure you put the notification bell on so that whenever I upload any video, YouTube will automatically notify you and you will never ever miss any of our videos. So back to our topic. What are the first 8 steps you can apply after injuring your muscle, or when your child or your relative or your friend injures his or her muscle? We have discussed about use of ice, rest, and now we are in the third one, which is compression. Compression. If the muscle are swollen after being injured, to reduce the swelling, wrap the affected area with an elastic bandage until swelling comes down or swelling subsides. To reduce swelling, wrap the affected area with an elastic bandage until the swelling comes down or subsides, and be careful not to wrap the area too tightly, as it can compromise blood circulation to the area. Your muscle has been injured. We are talking about compression. Your muscle has been injured. To reduce swelling, wrap the affected area with an elastic bandage until the swelling comes down or subsides, and be careful not to wrap too tightly, as it can compromise blood circulation. Let's go to the final part of the first aid, whereby we'll talk about elevation. Whenever possible, keep the injured muscle raised above the level of your heart. This helps in reducing the swelling also. Whenever possible, keep the injured muscle raised above the level of your heart. This can aid in reducing the inflammation. A point to note: other self-care methods which you can apply apart from the rise, or apart from rest, from ice, compression and elevation. We have other things or other remedies you can still use to relieve the symptoms or to relieve the pain. Number 1, you can use over-the-counter anti-inflammatory medication such as Brufen. It helps to relieve pain and swelling to go down or to subside. You can use over-the-counter anti-inflammatory medication, for example Brufen, that helps in relieving the pain and making the swelling go down. That's why it's called anti-inflammatory. Number 2, after 3 days, apply it to the muscle. After 3 days, apply it to the muscle several times, as it helps to bring blood circulation to the area for healing process to be fast. Apply it to the muscle several times, as it helps bring blood circulation to the area for healing. Number 3, don't rest your muscle for too long. Don't rest for your muscle for too long. This can cause stiffness and weakness. Begin light stretching as soon as possible and slowly increase the level of your activity. Don't rest your muscle for too long. This can cause stiffness and weakness. Begin light stretching as soon as possible and slowly increase the level of your activity. Number 4, make sure to stretch and warm up before exercising, especially footballers or athletes. Make sure you stretch and warm up before exercising because it makes the body acclimatize. When you return to normal activity, this will help increase blood flow to your muscles and decrease your risk of injury. Make sure you stretch and warm up before exercising because when you return to normal activity, this will help increase blood flow to your muscles and decrease your risk of injury. Number 5, make an effort to stay in shape. Make an effort to stay in shape. You are less likely to develop strain if your muscles are strong and healthy. So if your muscles are strong and healthy, this reduces the risk of being injured. A point to note, if your muscle strain is severe, you may need medical attention. Physical therapy may also be recommended. If your muscle strain is severe, you may need medical attention and physical therapy may also be recommended. A question we can ask yourself: when should you see a doctor when having a muscle pull or a muscle strain? When should you see a doctor or your healthcare provider when having a muscle strain or a muscle pull? Home treatment should be enough, but seek medical attention if home treatment or home remedy should be enough to relieve muscle strain, but seek medical attention if number 1, pain doesn't subside after a week. Pain doesn't subside or go away after a week. Number 2, if the injured area is numb. Number 3, if there is blood coming from your injury. If there is blood coming out from the injury. Number 4, if you can't walk. Number 5, if you can't move arms or legs. Let me repeat this one. When should you see your doctor when having a muscle strain? Home treatment should be enough, but seek medical attention if pain doesn't subside after a week. Number 2, the injured area is numb. Number 3, there is blood coming from your injury. Number 4, if you can't walk. Number 5, if you can't move arms and legs. This marks the end of our second video of the day. Tomorrow we'll still continue with the same topic. We want to discuss it in a slowly manner so that each and everyone who was asking about this topic can get to understand each and every detail, because this is our work and we have to deliver what we promised. Let's have a fabulous Sunday evening and may God bless us.